Before starting Botox Cosmetic 50-unit intramuscular solution, make sure to read the medication guide and patient information leaflet provided by your pharmacist. This medication is given by injection, usually by a healthcare professional. It is injected into the affected muscles for eye disorders, muscle stiffness/spasms, and wrinkles. When used for migraines, it is injected into the muscles of the head and neck. For excessive sweating, it is injected into the skin, and for drooling/excess saliva, it is injected into the salivary glands. When treating overactive bladder, it is injected into the bladder. The dose, number of injections, site of injections, and frequency of medication will be determined by your condition and your response to therapy. For children, the dose is based on weight. Most people start to see an effect within a few days to 2 weeks, and the effect usually lasts 3 to 6 months. When using Botox Cosmetic 50-unit intramuscular solution, you may experience side effects near the injection site, such as redness, bruising, infection, and pain. There is also a possibility of experiencing dizziness, difficulty swallowing, respiratory infections, pain, nausea, headache, and muscle weakness when using this medication to relax muscles. Additionally, you may notice double vision, drooping or swollen eyelids, eye irritation, dry eyes, tearing, reduced blinking, and increased sensitivity to light. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. Depending on your symptoms, you may require additional treatment such as protective eye drops/ointments, an eye patch, or other remedies. For those using Botox to prevent migraines, common side effects may include headache, neck pain, and drooping eyelids. If you are using this medication for excessive sweating, side effects may include non-underarm sweating, respiratory infections, headache, fever, neck or back pain, and anxiety. And for those using Botox for overactive bladder, side effects may include urinary tract infections, burning/painful urination, fever, or difficulty urinating. If you experience any of these side effects, it's important to notify your doctor or pharmacist. It's important to keep in mind that your doctor has prescribed this medication because they have determined that the benefit to you is greater than the risk of side effects. While many people using this medication do not experience serious side effects, it's still important to be aware of potential symptoms and seek medical attention if needed. Additionally, while it is rare, it's crucial to seek medical help if you notice any symptoms of a serious allergic reaction, such as itching/swelling, rash, severe dizziness, or trouble breathing. If you experience any other effects not listed, it's important to contact your doctor or pharmacist for further guidance. Before using this medication, make sure to inform your doctor about any allergies you may have or if you have a history of certain medical conditions. This product may contain inactive ingredients that could cause allergic reactions or other problems, so it's important to discuss this with your doctor. Also, it's important to inform your doctor of your medical history, especially if you have any bleeding problems, eye surgery, certain eye problems, heart disease, diabetes, signs of infection near the injection site, urinary tract infection, muscle/nerve disorders, seizures, trouble swallowing, breathing problems, or if you have had treatment with any botulinum toxin product in the last 4 months. It's important to be aware that this medication may cause muscle weakness, droopy eyelids, or blurred vision, so it's best to avoid activities that require alertness or clear vision until you are sure you can perform them safely. Also, limit alcoholic beverages while using this medication. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For older adults using this medication for overactive bladder, be aware that you may be more sensitive to the side effects, especially urinary effects. And for children using this medication for muscle spasms, they may be more sensitive to the side effects, including difficulty breathing or swallowing. It's important to discuss the risks and benefits with the doctor. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor, as it should only be used if clearly needed during pregnancy. And if you are breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions when using Botox Cosmetic 50-unit intramuscular solution. Certain antibiotics, anticoagulants, Alzheimer's disease drugs, myasthenia gravis drugs, and quinidine may interact with this medication. Always keep a list of all the products you're using and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center. In the U.S., you can call 1-800-222-1222 for your local poison control center. Canadian residents can call their provincial poison control center. An antitoxin is available, but it must be administered before symptoms of overdose appear. These symptoms may include delayed serious muscle weakness, breathing problems, and paralysis. It's important to seek medical help immediately if you suspect an overdose. Before starting treatment, make sure to discuss the risks and benefits of Botox Cosmetic 50-unit intramuscular solution with your healthcare provider. If you have any questions or concerns, be sure to address them with your healthcare professional. Botox Cosmetic 50-unit intramuscular solution is used to temporarily improve the appearance of moderate to severe frown lines between the eyebrows, glabellar lines, forehead lines, and crow's feet lines in adults. It is also used to treat overactive bladder, chronic migraines, and excessive underarm sweating. The recommended dosage is specific to each individual and should be determined by a healthcare professional. The optimal timing for taking Botox Cosmetic 50-unit intramuscular solution depends on the specific condition being treated and should be discussed with a healthcare provider. This medication is administered by a healthcare professional in a medical facility and is not meant to be stored or used at home. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.